you look at United Kingdom, United States, China, right? I believe those are the leading industrialized civilizations right now with the highest rate of oral cavity airway discrepancies.
Hmm.
So, fast food diets, they're drinking smoothies and milkshakes, right, for
Hmm.
breakfast. So there's just so many factors that go into it. But it is horrendous. And I think that you're starting to get the common theme of this space is that like we have scratched the surface of really what's going on. People freak out about coronavirus and epidemics. We've got a silent killer that nobody is really. The news doesn't talk about it. Physicians don't screen for it. Dentists don't screen for it. Very few even know what it is. People think you just snore. It's snoring. Now, snoring isn't always associated with obstructive apnea, right? Because snoring is just vibrating of the soft upper palate. But usually they go hand in hand. And it's a movement. We need to create, like you're doing, Ron, is educating people that your snoring could be killing you. And people don't understand that. They take it very lightly. But you tell a man, which is funny because in our office, either patient comes in because of the wife can't tolerate the snoring anymore, so they send their husband in, or
Hmm.
they're borderline dying and they need help, or they can't get a boner. That's what men care about, right?
Yeah,
But they
yeah.
don't understand that that is probably because of their airway discrepancy. So typically when
Uh,
we tell patients, do you have impotence? That's when they're like, yeah, why? Well, you're not sleeping at night. Where do I sign? How much is this? I don't care. So.
right, right. What's the connection there?
Well, I mean, if your hormone production is at night, right? Specifically in
Right.
the REM sleep. So if you're not in that deep REM, your thyroid, your hormones are not producing levels, and your testosterone, I mean, just
Hmm.
down. And then that
Hmm.
means no sex drive. So
Hmm.
there's a direct correlation there.
So, how do you feel about the fact that this problem is so widespread and top tier providers like your dad are one in what, 7 billion?
Yeah,
I mean, are we really headed in the right direction here?
I hope so. I think you're the right direction. I think people like you, people like my dad, people like Lipkin, people like Dr. Moon, these are all pioneers, right? They're like the Michelangelo, the Da Vinci's, man. I think this is going to be history that's going to be written for these guys who went against the norm and took this step to do something that people thought were wacko. I remember when my dad came out doing this stuff 10, 15 years ago, they thought he was a straight up lunatic. He used to teach at the University of Washington Dental School, which is the best university we have in Washington. That's where I got my master's. And he was told to leave that school or stick to their curriculum if he kept talking about his philosophy. And guess what he did? Obviously, was leave because he knew it was a huge mistake. I still think the industry as a whole is probably 15 years behind. What we're talking about right now, I think we're 15 years ahead, is what I'm trying to say, from the rest of the understanding of even, man, the physicians I talk to. They have no clue about anything oral cavity related. If you tell a physician an ENT about airway, they're going to tell you to either cut your palate, do some sort of a surgery, or cut your tongue.